With everything going on in the world, people need to be uplifted. They need something that promotes character, creativity, confidence, and joy. The GRN show is not just an average talk show. The topics are powerful and will make you think. Join me on this journey to be informed, to relate, to connect, and to evolve.
Good evening and welcome to the GRN show. The past year has been challenging. We've experienced a number of natural disasters throughout the world, including earthquakes, wildfires, storms. And then, of course, we're trying to get back to normal and a whole resurgence of the Delta variant of COVID 19 is really impacting our lives. So, combine those incidents with the number of people who have lost their lives. The impact on our mental health is inevitable. As Naomi Osaka says, it's okay not to be okay. And she stood firm to focus on her mental health and her well being after she won a tennis championship. So, our focus tonight is look at the importance of our mental health in a time of chaos. So, we have with us today two experts, various disciplines for this conversation. I'd like to first introduce Yolette Williams, a licensed clinical social worker and a psychotherapist. Yolette, welcome and thank you for being with us.
Thank you for having me. It's a pleasure.
Super, super. And then with us, last but not least, we have Dr. Ernest Barthelemy, a neurosurgeon. So, Dr. Barthelemy, welcome and thank you for joining us for this conversation.
Thank you for having me on the show.
Super. With my distinguished panel, when you look at the correlation between the two disciplines, they really all have quite a bit to do with how we feel mentally as well as how we feel physically. So I'm going to start with the first question, Dr. Barthelemy. How would you describe mental health and what do you consider good mental health?
Great question. So mental health to me refers to the psychological, emotional, social, and some would include spiritual spheres of one's wellness or state of well-being. As a neurosurgeon, I often think about how brain health is integrated into the concept of mental health, although historically we're not usually thinking of it in those terms. But these are all experiences that tend to occur in and through functions that we can identify in the brain. Good mental health, I think the best way to answer that, given the current time and the stresses we're dealing with, is the idea of resilience or resiliency. But I think in much of the mental health literature, people are getting very interested in how does one develop the resilience to deal with stressful events, issues, concerns. So resiliency quickly is or can be defined as the ability to undergo a very stressful, challenging, difficult, or even tragic event and bounce back or come away from that event without lasting psychological or psychiatric illness of some kind. So freedom from that sort of from lasting insult to one's mental health, despite going through a very challenging experience for one's mental health, is what I would call good mental health or resilience?
That is a great way. Resilience obviously is what I pick up from it. But I have to tell you, over the last, I don't know, couple of months, it's like one incident after another, to the point where one of the incidents, I was having a very difficult time sleeping for about a week. So post traumatic stress, I imagine, and I'm going to ask you, Yolette, what are the indicators and effects of post traumatic stress? And can post traumatic stress be short term and long term?
Yeah, absolutely. All this that you have indicated, all the trauma, all the events that have been happening in the world, we are suffering from cumulative trauma, and the nervous system has then had a pause because things are happening one thing after another. And so we talk a lot about post-traumatic stress disorder, but some amount of stress, it's a normal reaction, because when something happens to us, it's normal to have a reaction. Because when it becomes a disorder, it has to be a little bit more consistent and systematic for at least a period or at least a month for us to even say it's post-traumatic stress disorder. And when that happens, it's when a person has difficulty to recover from an event that they have experienced or witnessed, an event that is terrifying. The condition may last a month, it may last years, and it could be delayed. So post-traumatic, it's when you have suffered prior experiences, which many people have experienced trauma in their lives. I was reading that the CDC has reported that children, 1 in 4 children, for example, have experienced some sort of trauma, might it be sexual, physical, or neglect. Women, 1 of 30 women have been raped. Men, 1 of 70, and other systemic trauma that impact a lot of people, racial injustice. So it's a lot of trauma to impact. So when these traumas are not dealt with and you don't get the right support, then it's so much more difficult when you experience another trauma to recover. So yes, trauma, we could have experienced a trauma for a couple of weeks, you don't sleep, which is normal. And then you're okay after that. But for some people, it takes a longer time. And there are some people, it's more delayed. And there are some people, it's chronic. Yes.
Interesting. My first, I guess my first perception of PTS or post-trauma symptoms is really, you think of people in the military who've experienced. So to me, that's really what, of course, PTS is. And of course, you've mentioned, if someone has been violated, but when you look at the event and even the earthquake in Haiti, looking at the suffering, it really took me a couple of days to be myself, because obviously, you kind of absorb that. So what I've gathered, it's normal. Short-term PTS is normal. One just have to ensure that it doesn't last too long, or if it's delayed, they have to deal with it. Is that what we're saying?
What I'm saying now, a reaction, which is a stress reaction, it's normal. But if it's taking more than time, if it's interfering with your daily living, if it's interfering with your sleeping, if you're having flashbacks, if it interfering with your memory, and you start having this difficulty, it could be both emotional and physical. It requires intervention.
Got you. Thank you for clarifying that. And we all have a brain. So mental health, we all have to take care of our mental health. So Dr. Barthelemy, how does mental health affect our bodies, and what are some of the conditions that you as a neurosurgeon would detect in one of your patients?
That's an excellent question. How does mental health affect our body, and what are conditions I would see that result from, I'm going to take your question to mean disorder of one's mental health, some sort of a mental disorder that can produce a neurosurgical condition. Well, one way to talk about it first is just to think about what aspects of one's brain. If we think about, the brain as the organ responsible for either good mental health or a disorder in mental health, then many parts of the brain are involved. But I'd say in terms of stress, because I think this is a conversation about stress in the background, right? And stress related to trauma in particular. The stress system is very important. This is key. So we have a couple of small, very, very important parts of our brain right at the very bottom of the brain, in the area of the brain that lives just behind the nose, okay? And neurosurgeons know this because sometimes we do surgery through the nose to get to this region, okay? In fact, when I was getting my first COVID test, the physician who knew my specialty said, basically, we're going to your brain with this. I said, okay, well, I said, don't penetrate anything because we don't want to get there. It was meant half in jest, but it did suggest, there is a gland there, the pituitary gland, that is an important gland for hormone production and has a very close relationship with the hypothalamus, which is another important gland sitting just behind it. And I don't know what the sophistication of our listeners is, with respect to biology or the brain, but I'd say these two glands, the hypothalamus, okay, hypo means under, it sits under the thalamus for whatever that's worth, and the pituitary gland. So both two little organs sitting behind the nose are responsible for producing all of the hormones that generate automatic activity in our bodies. And they communicate with organs that sit on top of our kidneys, the adrenal glands, to control our response to threat. So when we think about the fight or flight response, for instance, there are two divisions of the automatic part of the nervous system. One that is one that causes stress, and one that moves us away from stress. So if you think of a very frightening or startling situation, and the situation has passed, but you're still shaking because of that, right? Or your blood pressure may have gone up. All of that is from hormones that flooded your bloodstream from this conversation between your brain and your adrenal glands, which sit right on top of your kidneys in your back. And they produce this epinephrine or this adrenaline that filled your bloodstream. Well, it's one thing for that to happen once or twice. It's another thing entirely when it starts to happen over and over and over again. And that can have damaging effects in many different parts of the body and can certainly contribute to worsening blood pressure, which is one of the chronic conditions that absolutely plagues our Haitian community. And blood pressure is the number one most controllable factor in preventing stroke. So, by the time I'm seeing a patient for a blood pressure related problem, it is way, way, way too late. We wanted to deal with that a long time ago because that stroke has either produced a shutting down of a blood vessel in the brain that makes it difficult or impossible to control the part of the body that part of the brain used to control, or they may have a weakening in one of the blood vessels in the brain called an aneurysm, which is like a little bubble that lives on the side of a blood vessel from a weak wall in the blood vessel. And all of that high blood pressure over time can contribute to a weakness where that aneurysm can spring a leak and start bleeding around the brain. And that causes all sorts of life-threatening consequences that will have a patient get to know me very well in the hospital for, for a couple of weeks to make sure they can survive that and move through it. So, stroke, I can come up with so many examples, but it's a really, I think, salient one that illustrates how a failure to deal with stress in a healthy way can lead to very severe disease. And I have one last thing I want to say about this topic. My background happens before going into medicine. I was a personal trainer, and I got a master's degree in exercise physiology. So I got an education about exercise that a lot of doctors don't have the privilege of developing. And one of the great things about exercise is it actually increases the activity of the branch of the nervous system that keeps things quiet. So exercise is an outstanding tool in your toolbox to develop mental health and promote safety from diseases like stroke, because it can increase your body's activity in this calming branch of the nervous system.
Got you.
I wanted to add something to what Dr. Battelle, not add, expand on it, because when he said fight or flight response, it's something that, particularly with patients with post-traumatic stress disorder, that present a lot. So when we get patients like this in therapy, the role of the therapist is we do a lot which we call cognitive therapy. We'll help with the cognitive restructuring. We actually spend time working with the patient, explaining what is happening. Actually, it's the body's kind of warning you, danger, danger, is for you to calm down. So once you do that and you explain to the patient why you're breathing heavily and your heart is palpitating, and you restructure them, that really helped a great deal. And so I thought that was quite interesting, that this kind of panel.
For the benefit of our viewer, why don't you explain the terminology that you guys have just used? Fight or flight?
It's fight, flight, and freeze.
What is it? Fight,
flight, and freeze.
Flight. Okay.
So meaning something had happened to you, you get scared, you want to run, and then you freeze, you become numb. So the body does that. It's a nervous system response, because when something traumatic happened, your brain kind of make a picture of it. So it kind of reminds you that, hey, danger, danger. So at the same time, you're afraid, but there's always the flip side.
Gotcha.
It's also protective.
Gotcha. I find that mental health, there was a time there was such stigma attached to it. And I think over the years, what I've seen is an evolution where it's part of our everyday conversation. When you look at Simone Biles, the gymnast during the Olympics, you look at, when you look at someone who's very like a celebrity, or who says, hey, I got to take care of me. I have to take care of my mental health. I think it really has taken this particular issue to the next level. So let me ask you, where do you see us going with that? In your practice, do you think people are more accepting in our Haitian American culture, in our Haitian culture? Or are you seeing patients accepting the fact that they need help? Just enlighten us a little bit about that, please.
Well, there's still very much a stigma attached to mental health in all communities, but unfortunately, the Haitian community, Caribbean, or even the African American, we are less likely to accept that, because we are thought, you're strong, we infallible, or we take care of ourselves. And some people, which is okay also, will go get spiritual counsel. But more and more, as people getting sick, they're somewhat more accepting. What I find
Mhm.
personally, if there's a crisis, someone would come, but when they start feeling better, then you will not see them again. So we have a long way to go. And that's why I'm very happy you're doing this show on mental health, because we have to keep educating people. Mental health is nothing but another health diagnosis. If you're diabetic or people are hypertensive, somebody has mental health. And in every family, in every community, ethnic, social, economic status, it does not discriminate.
That's true.
Um, and we're talking about all kind of level of mental health, just like Dr. Barthelemy just said. Sometimes just that it's temporary. It doesn't have to be you're not feeling well, you're well-being, and you're not exercising, you're feeling sluggish. That's part of your mental health
That's
or your self-care and well-being.
You know, on that note, Dr. Barthelemy, we all have a mental health. We all have to take care of it. We all have a brain. That's what I like to say. We all have a brain. So we got to take care of it. How do you interact with the other team members that a patient may have? For example, maybe a nephrologist, maybe their primary physician. How do you interact with other team members to ensure that the patient mentally is well?
Yeah. Yeah, this is a great question that is highly relevant for my subspecialty in neurosurgery. So I actually am currently training as a neurotraumatologist, which means that I am focusing in an area of neurosurgery that takes care of people who have suffered mechanical injuries to their brain and spine, and some emergencies of the brain and spine that are related to that field. And why it's so relevant is because that means every day I have a series of patients in the intensive care unit to round on with a very big team. And patients who are in critical care require a team to take care of them, because so many different perspectives need to come in to take care of the whole patient. And just to jump to the direct answer to your question, okay? We have amazing social workers in the way of social workers who are focused on bringing in the psychosocial and often economic aspects of what the patient is dealing with that help us to address those issues as they come up, which can help us understand how a patient got where they are, which can help us make choices that serve the patient while they're there and put them in the best position to leave the hospital without a huge burden in their life, financial or otherwise, if we can do that. Often that's hard in the US, okay? Now, this is for in the case of the patient that's doing well. In patients who are quote unquote not doing well, who may be moving towards an end of life situation, in my practice, I see a lot of those patients. So, that's just the nature of neurotrauma and neurocritical care. And that will open a huge sphere of the spiritual and emotional care of the family that has to really match the needs of the family, the cultural views of the family. And so those of us who are trained to take care of these patients will bring in these spheres in our conversations as a first step, but will often involve a palliative care team in the care of the patient. Palliative care is really a wonderful specialty. A lot of people are frightened by the term palliative care because they tend to think that palliative care means, oh, this is a doctor who you bring in when someone is going to die. That's not necessarily true, although that is a part of what they do. A palliative care physician is actually specialized in doing what you're talking about. talking to all of the team members. If there is a kidney issue, talking to the nephrologist. If there's an infectious disease issue, talking to them. If it was a severe brain injury, they'll spend a lot of time with me. And they will actually bring us together and help to moderate conversations with the family so that everyone can contribute the perspective we need to understand a very complex patient and what the best next steps for that patient are. Whether or not that's going to be a continued fight to try to see if we can find a way, or if it's honoring the patient's wishes and recognizing if this person could speak for themselves, they would never want to be dependent on a machine indefinitely. So this can get very, very specific and particular and complex. And the palliative care teams can often be a great ally in helping us to tie that complex picture together.
Great, great. I'm learning quite a bit. Now, we live in a different world. Everything is digital, and I imagine, for example, after the earthquake, somebody sent me a flyer if family members or friends want to speak with someone. It's similar to employee assistance program. They can actually just call. They can do a duo chat. They can do a video chat, basically, really where both the professional nor the patient have to leave their home. So both of you, tell me how, and I'm going to start with you, Yolette. How has the digital time has changed? How has that changed your profession?
It has revolutionized the profession, most definitely. This year the mental health theme was "You are not alone," and even during COVID, just using Zoom to, like, a lot of people had parties on Zoom, connect with family members, just talking about regular everyday well-being, this kind of connectedness that maintained us sane during this difficult time. But more to it than that, you can actually do therapy and provide services virtually. My organization, the Haitian American Alliance of New York, which I am the executive officer, this is something that we've done throughout COVID. We've done several mental health presentations to educate, to uplift, to provide well-being. But even in Haiti right now, we've partnered with another organization that which is Society of Haitian Neuroscientists.
That is awesome.
And the goal is to reach out to communities in Haiti, one particular group, and not just to assist them, but also to work with community on the ground to strengthen them, because the goal is to give help, but also to have capacity building in Haiti.
That is amazing. That is wonderful. That's the beauty of technology. I'm not one of those who always think very positively of technology, but what I have seen over the last 2 years have been really amazing. So Dr. Barthelemy, how about in your field? How has this digital time, how has it affected positively, negatively, your profession?
Sure. Well, the effects are mostly positive. And, I will briefly say that even as surgical care and neurosurgical care has been very threatened by the COVID pandemic and has forced us to make very difficult decisions about what constitutes essential neurosurgery and emergent neurosurgery, which can be very challenging because before COVID, we didn't need to have as extensive a consideration of someone who is debilitated by a very large brain tumor, for instance. However, in the world of COVID, that patient all of a sudden becomes an elective surgery and not an emergency, right? And so the policy doesn't always match the clinical understanding of what's going on, right? Particularly when you're dealing with a patient's brain or spinal cord and nerves. So the impact of the digital age is it has enabled us to perform teleconsultations, to connect with patients, to connect with their families, and to come to a shared understanding of what is the urgency of what's going on, what is the risk involved in getting the care that they need in the current era of this pandemic. And it has helped us to find a way to prioritize in a situation where it almost seems impossible to prioritize. I'd like to add, I appreciate Yolette mentioning the society I co-founded and of which I am the president, the Society of Haitian Neuroscientists. This digital age has also revolutionized our work and even the growth of our organization. We're quite young. Currently, we have 59 members, and the society consists of people of Haitian descent on 4 different continents, all whom are specializing in one of the neurosciences. And our mission is to advance neuroscience in Haiti, to promote the neurological and mental health of all Haitians in all Haitian communities, so both within Haiti and throughout the diaspora, and also to foster collaborations between neuroscientists in the Haitian diaspora and in Haiti, so collaborations between Haitian neuroscientists. Well, there's an important social and networking function built into our mission. And now here we are advocating to advance this mission in a context where we can't meet, we can't gather. So we started hosting social Zoom parties so that members could connect with one another. And just as Yolette said, it was actually revolutionary because what we had was the ability to meet with a Haitian neurosurgeon in France, a Haitian neurologist in Medellin, Colombia, a Haitian neurophysiologist in Haiti, and a neuropsychiatrist in DC. People who probably, otherwise wouldn't easily, get together for a quick meeting. And I would say that not only were those digital gatherings enjoyable, they were therapeutic. I think they enabled us to solve a problem of coming together and to connect in a very profound cultural way that served us.
That's terrific. So again, what I'm going to ask each of you, what would be your last word to our viewers in terms of minding and taking care of their mental health during this chaotic time? So Yolette, I'll start with you.
Okay, definitely self-care. And self-care is not just taking a bubble bath.
It helps sometimes.
It does. I say it's not just, it's a lot more than that. It's go for a walk. You need the vitamin B, the vitamin D anyway. Go for a walk. Enjoy nature, the environment. That helps a great deal. Also, exercise if you can. And simple things such as eat a nutritious meal, sleep well, take time for yourself, disconnect. There's a lot of bad news going on. Some people just go and just, put it down. And even those digital things that we just talked about, disconnect a little bit.
Put the phone away.
Yeah, just for a little bit. Self-care is very, very important. Awesome. Because you need that to reboot, to rebuild, and to help others. And in these times that we live in, we need to take real time to stop and take care of ourselves. And there are many apps out there that can help. People can do mediation, people can pray, people go to church, or people who have different beliefs. All these different things. It's very important to connect, even if it's virtual.
Great, thank you. And Dr. Barthelemy?
I would not add too much to what Yolette said. In fact, I think she gave quite a comprehensive list. What I can share is some of my own practices. And there are some apps that I find useful for going to sleep, because sometimes I struggle with sleep. And these apps can create a calming environment. Some of the ones that create rhythms, they're easy to find. Just search them on your app store. I carry some responsibility as a leader of the organization I work with, and also in my clinical environment. And being an effective leader does require one to get beyond whatever otherwise would get in the way of your ability to connect with other people. So it does require a great amount of self-care. And I've noticed over time that when I wake up in the morning, my mind could be doing anything. I have no idea, right? It can be racing, it can be thinking about some random thing. But I have produced a mission statement for myself that I took time to define over the years about who I'm committed to being in my profession, in my family, in the Haitian community, and what I am committed to my life being about, so that whenever I disappear from the planet, because I know I will, everybody will.
We all will, right?
Precisely. But I know that that every breath that I breathe, every day I was on this planet, I was living in alignment with a commitment that was bigger than myself. And that's very freeing. So what I do first thing in the morning, I actually recorded myself reading that statement. And as a ritual, it's one of the first things I do is I just play that recording and I listen to it, and it gets me back into the conversation I want to make sure is starting every single day.
Very nice.
Yeah, and so that has really provided me a powerful context to take care of myself when crazy things happen.
Great, well, super. I could not ask for more. I want to thank you for joining us. I think this dialogue has been very insightful, and I've learned quite a bit, and I'm sure our viewers will as well. So thanks again for joining us, and we'll be speaking soon, and good luck with both organizations.
Thank you. Thank you, and good luck with JNR.
Thank you.
Yeah, thank you. Thank you for having us. This is great.
All right. Good night.
Night.
We'll be right back. Done.
It's okay to think you're in a toxic relationship with the world right now.
It's okay to feel like your world is changing.
It's okay if it's hard to find the words to express how you feel.
It's okay to feel like you just want to become someone else.
It's okay if you're panicking over an inability to control your life right now.
It's okay to have trouble maintaining your normal routine while staying home.
It's okay if you're feeling more cynical than usual.
It's okay if you want to curse more than you usually do.
It's okay to wear your favorite tank top several days in a row.
It's okay to miss your job.
It's okay to just stay quiet.
It's okay to be depressed.
It's okay to talk to your cats like they understand what you're saying.
It's okay not to feel the most fabulous right now.
It's okay.
It's okay.
It's okay.
It's okay.
It's okay.
It's okay.
Okay.
Hello, Dorothy.
Hello, Gitel. How are you?
Doing good. You know, after hearing our guest this evening, it further reinforced the fact that our well-being really begins with our mental health.
You are absolutely right, Gitel. Matter of fact, today's topic is coping with the problems of today and staying sane. If you are someone or knows a person who worries and experiences anxiety when you think of what's happening around the world and what may be happening to you, you need to just stop, be still, and breathe. With the pandemic, death, climate change, earthquakes, or constant bad news on the television or social media, it's like one thing after another. You tend to feel, when will it all end? This can really have a great effect on a person's life and health. Whether it's stress, anxiety, or depression, our constant exposure to all of this can make us feel pretty nervous about the state of the world today. It's said that Americans are among the world's stressed people, according to the American Psychological Association, based on a survey that was given back in 2019. We have to find ways to manage our worries and anxiety when we feel everything around us is in turmoil. Here are some great ways and tips on how to manage your stress level when you feel worried or see chaos around you. First, like I said, stop, take a pause, and breathe. Practicing to take long breaths and managing your breathing tends to slow your heart rate down, releases tension, and helps you to collect your thoughts to get things into perspective. By practicing this, you will know how to handle bad situation or even news. Secondly, manage time on social media and especially watching the news. Like I mentioned before, with so much going on around the world and constant bad news, taking time out to focus on other things and spending more time with our loved ones and family helps to isolate the worries of the world and anxiety. And finally, live a healthy lifestyle by getting the exercise and enough sleep. Take care of yourself, especially when having constant worries about situations that can be beyond our controls at times. It starts to affect our body and health. Losing sleep, having large or no appetite, and also isolation from others. Our bodies begin to take a toll on us, causing these health problems. These are the things we must avoid, and especially live and enjoy our lives. So these are my tips for this week on coping with the problems of today and staying sane.
Terrific. Thank you so much, Dorothy. You know, I think one thing that comes up with everybody who's spoken with, that I've spoken with this evening is the benefits of exercising.
Exactly.
And that not only is it good for our physical being, but definitely for the mental health. So again, thank you for your tips, and I'll see you next time.
See you next time, Gitel.
We'll be right back.
Dans VidaMax, nous gagnons une pharmacie en deux cliniques là même. Sous besoin de service, vous capable venir dans VidaMax, relez-nous dans 954 239 70 54 ou bien 786 464 51 20 pour plus facile pour en créole. Adresse dans VidaMax 6109 Pembroke Road, Miramar, Florida 33029. Et sous arrêté dans zone Hollywood, vous capable aller dans 2040 Washington Street, Hollywood, Florida 33020. 2040 Washington Street, Hollywood, Florida 33020. Nous invitons pour capable venir dans VidaMax pour tout soin médical.
Non, c'est Gina Baptiste, moi t'as mais bah nous
VidaMax.
Ça c'est VidaMax.
Good brain health is a state we all strive for. We want to optimize our cognitive, emotional, psychological, and overall functioning. Our days are filled with work, community projects, family, parents, and more. And often we neglect ourselves. I'm guilty of that. I would like to urge you to take time out to really make yourself a priority. Let your mental health be a priority for your overall well being. Once again, we thank you for joining us, and until next time, enjoy your evening.